What's up, Chicago? It's your boy Zach Boog, and I am out here with the Cook County Department of Public Health in Calumet City, right down the street from River Oaks Mall. And I have a very special guest here to give us some information on vaccinations.
Hi, I'm Dr. Rachel Rubin, and I'm Senior Medical Officer and a co-lead of the Cook County Department of Public Health.
That's right. Dr. Rubin, it's a pleasure to be interviewing you right now because I hear so many wild, crazy, stupid things about the vaccine. Can we just bust a few myths?
Absolutely.
Okay, let's get started with the microchip thing. I hear that all the time. People say, oh, the government is trying to put a microchip in you and track you, and track your location, track where you are, and control your mind. How true is that?
It's totally false. I don't know how else to put it. Nobody is putting a microchip in you. We all have devices. There are cameras everywhere. Frankly, if the government wants to find you, they can find you. There's no microchip. There's no reason for microchips. They're absolutely, it's a wonderful story to pass around, but I can tell you there is no truth to it whatsoever.
Thank you. You know, people say that they researched it on Instagram. Listen, if you're getting your research from Instagram, there's a high possibility it may not be true. Okay, let's just say it. All right. But on a more serious note, some ladies who are trying to conceive and have children, or ladies who are pregnant, may be worried about getting the vaccine, saying that it may hurt them with fertility.
I mean, I could understand that would be a major concern of a woman that wants to get pregnant or is pregnant. But no vaccines, including these, have created any problems with fertility. Any of the vaccines that we've had around for a long time, our tetanus vaccines, our measles vaccines, our flu vaccines, and neither do these vaccines affect fertility. And in fact, it's very important to get vaccinated before you're pregnant or while you're pregnant, because it could create problems with the fetus if the fetus is born with COVID. That could be a very serious illness.
Yes.
And it is also possible that if you're pregnant and get COVID, you may have a more serious reaction to the COVID illness than if you have had the vaccine. You then have a much milder form of the disease if you do catch it. But you generally will protect you from getting it during pregnancy, and it will protect your baby.
That's right. You can protect yourself and your child all at the same time. Also, just speak on the importance of getting vaccinated. Some people will say things like, well, you can still catch COVID if you're vaccinated. Why is it important that I get vaccinated? What is it doing? Please explain the importance of vaccinations.
Right. The only way that we're going to get out of this pandemic is by having almost everybody, hopefully everybody, vaccinated, frankly, worldwide, not just in the United States. So we need to be sending vaccine to countries that don't have the ability to produce their own. The reason that's so important is because the vaccine will prevent people from getting the disease in the vast majority of cases. We do get some people that have been vaccinated, a very small percentage that get what we call breakthrough cases. And that's where you get COVID illness even after you've been vaccinated. But in almost all instances, over 99.9% of the time, the person that gets one of these breakthrough cases after being vaccinated have a very mild disease. You're not going to end up in the hospital. You're not going to die from COVID.
Yes.
But if you're not vaccinated and you get COVID, you have a much higher risk of being in the hospital and potentially dying from the disease.
So there you have it. You see the importance of getting vaccinated. Dr. Rubin, you have been absolutely amazing. Hopefully we answered your questions. Get vaccinated, save some lives, save your life, save your family. Do it for your family. That's why I did it. I have to be honest, at first I was a little skeptical, but then I was like, I'm a comedian, I'm on the radio, I'm out in front of people all the time. I had to protect my family, and I think you care about your family enough to protect yours as well. So I hope to see you out. Get vaccinated. We're here.